Welcome to our Vietnam Health Clinic info session for the recruitment, for our advisors to the board committee. Before we start, love to talk a little bit about Vietnam Health Clinic and our mission. As you may know, Vietnam right now is a developing country. It's grown quite a lot, but the health disparity is still a large gap between those who have access to healthcare and those who don't. There's quite a lot of folks who are still very much to this day dying because they don't have access to primary care. They live too far from a doctor, so the need is very much there. So because of that, with Vietnam Health Clinic, one of our mission and goal is to provide access to quality healthcare and services to these under-resourced areas of Vietnam. On the other hand, we also work with students and empower them to lead the organization, as well as pursue the essentially higher education within the healthcare field. So we promote proactive learning and first-hand experience in primary care for our student members. Just high-level background about Vietnam Health Clinic. We started our first medical mission back in 2009. Really kind of started out with very basic primary care and providing, treatment for acute care for the patients that we saw. And each year from then on, we started adding components, different services, different specialty care to our organization. And these specialty services really intended to provide sustainable and longitudinal services for these patients. For example, in 2010, we added a dental component, focusing on a lot of extraction work. And then, we gained our 501c3 status. We then added an optometry component, evaluating patients' eyes, as well as providing reading glasses. Then we added public health because, we realized that with the work that we do in a mobile clinic setting, it's really important for us to focus on education, because with the right education is how these patients, take care of their own health when we're not there. We also established formal partnerships with local pharmacy schools here in Washington that allow their pharmacy students to come with us as part of their international rotation. We then added physical therapy to really focus on chronic pain management, posture, massages, exercises, things that they can use to continue to do when we're not there. And then, moving forward with our goal of creating and maintaining partnerships with entities in Vietnam, we started a partnership with Vietnam National University. It's a large international university in Vietnam that have medical students and pharmacy students, and we partner with them to exchange knowledge with our own students, and we tap into them for them to come out and support us with the medical clinic as well. So for the last couple of years, when we go back to Vietnam, we've been focusing our effort in the central region of Vietnam, because these areas of, we would go up to the mountainous areas, and these areas, they live quite far from the nearest city, live quite far from the nearest hospital. So they truly need the kind of care that we provide. So then we started to expanded out some of our programs for the last couple of years as well. We partner with Da Nang Eye Hospital in Da Nang to provide cataract surgeries for our patients. We added restorative dental care to our dental component. So no longer do we just do extraction work, but again, continuing with the goal of sustainable effort. How do we ensure that we maintain the patient's teeth so they can have a long and healthy quality of life? And then COVID hits. So, for the last 2 years or so, we've been focusing our effort here in the state of Washington and address the need that came with COVID. We identified early on that there's a large community of underserved immigrants having a lot of barriers to accessing COVID, having a lot of barriers to getting the right information about COVID. So we built out a lot of translated material about COVID on our website. We hosted one of the first vaccine clinic for the underserved community here in King County. We also hosted a couple of days of clinic for the community here as well. And we are aiming to have a clinic in Vietnam in 2023. So that was a bit of a background on our work so far. Wanted to give everyone a kind of a high level view of our organization. It's a nonprofit, everybody is volunteer based. We have a board of directors that help support and steer the roadmap of the organization. Then we have our student affairs directors that we kind of help support our student officers. These student officers are the one who we are empowering to kind of lead the day-to-day activity, to support our student members, support our healthcare professionals, and other kind of volunteers within the organization. So these are the officers that I mentioned. They're the one who will be working directly with the student members, and really kind of help the day-to-day planning the medical mission for the organization. We have Rachel and Julie, who are current student affairs directors who help supporting the student officers, and our current board of directors, myself as a pharmacist, as well as Milian, who I have here with us today. So Milian, you want to introduce yourself real quick?
Sure. Hello, everyone. My name is Mai Lin Nguyen. I am a pharmacist by license. I've been a part of VHC since 2012, overseeing more so on the clinical operations, and I really look forward to working with all of you who would like to be part of our advisory board committee.
Yeah, as you can see currently on our current board of directors, we have a couple of pharmacists, and we have folks who have experience in other areas such as public health, marketing, law, and it's pretty well-rounded, board, and for all of us, and we have a lot of experience with managing a nonprofit organization, but there's definitely gaps that we have as well, and I think that's what we're here, trying to expand out and recruit help in areas that we are not experts in, looking into folks who have the expertise and have the capacity to help. So excited to kind of tell you guys more and work with you guys. So this is kind of high level what we do with our mobile clinic in Vietnam. This is a general workflow for each of the components. I'll just go over kind of each component individually here. So what happens within our clinic when we arrive in Vietnam is it starts out, we would go to a site, we set up our clinic. When clinic starts, patient would go to the first component, which is an intake where they get added into the system. And then, we have our students take the vitals of the patient. We have our nurses triage the patient, identify chief complaints, and really understand their needs and why they're there. And then, the patient would then get moved on to different areas, different components that we offer, whether it's visual acuity or, kind of high level screening of their eyesight, and then get passed on to optometry, evaluate whether, we can give them readers or not, evaluate whether they need cataract surgery referral or not. And this is some pictures of our last cataract surgery pilot, where we're able to provide cataract surgery for almost 20 patients. And then patients then get seen by physicians to kind of triage their acute need or whether it's chronic need. They get to speak to physicians as well as students, and they would have diagnosis and treatment for this component. Then they would go to physical therapy, if they complain of musculoskeletal pain, if they're not mobile. We have our PT who work with them, teach them exercises. Sometimes we provide wheelchairs and cane to help with their mobility as well. And then our dental component, dental care is one of those services that sorely needed for the areas that we visit. Folks don't have the resources available to them to get dental treatment. We started with extraction, and with the recent expansion and tool that we bring, we are able to do more restorative care now. We can do dental cleaning, we can do crowns, and we want to continue to move toward that direction. So here's some pictures of the restorative care that we provide for a patient. And then public health, we believe that education is a critical component to ensure that patient will continue to maintain that healthy lifestyle before or after we leave. So we have educational material for every component that the patient visits. We also have a separate public health component that, through fun activities, through games, they get to interact with our students to learn about how to manage chronic disease states, how to take care of their eyes, take care of their teeth, things that they do in day to day to help with their lifestyle. And then pharmacy, every patient ends up at the pharmacy where they get to pick up medications, they get to pick up gifts, they get to speak to a pharmacist and a student, and being educated about their medications and ask any questions that they may have. Yeah, so that was kind of a typical operation that we do in Vietnam for a mobile clinic. This is just kind of talking about what we did here in Seattle when we couldn't go to Vietnam and we had a clinic here. We believe that just because we are unable to Vietnam, that our mission shouldn't stop, that we still need to identify the underserved populations here and anywhere that we are, and to provide the kind of care that they need. So like I mentioned before, we have quite COVID vaccine scheduling assistant programs. We put up pop-up clinics, and we really went out to the heart of communities, whether it's a temple, whether it's a church, to provide a care that folks need. So talking about advisors to the board, like I mentioned before, right now as an organization, we still need quite a lot of expertise when it comes to the external and internal methodologies and operations that we are executing. So I think that's where we are looking out and then see how we can get the support that we need. There are the clinical components that we've always talked about in terms of how do we expand our medical component, how do we expand our optometry component. We don't have any expertise when it comes to certain finance, so I think what we found is that there are quite a lot of folks who are subject matter experts in this field and who wants to help. So I think this is our effort of tapping into those folks and give them a proper channel to come and support us. So I'll pass on to Millen to speak more about the advisors to the board committee.
Yes, thank you, Kevin. And just to echo with Kevin, we definitely are leaning to all of those who have a passion in helping a growing organization to help continue to serve our mission and vision in improving access as well as quality health to our Vietnamese community. Now, I know that there's always questions on, okay, great. Now what does that entail for you as our advisory board member? What are my responsibilities? So I wanted to take a moment to just kind of go through some of the key elements that we're requesting of our advisory boards. Kevin, if you help me go to the next slide. Again, we just kindly ask you to essentially serve as our sounding board. It is to allow us to go to you as our go-to expert, right, in your field of practice, whether it's in dental, opto, physical therapy, finance, whatever that you're in, and that we can seek your expertise as we are expanding out or building on our current and existing programs. We want to be methodical about it and strategic about it. What would be the appropriate equipment to procure, knowing that we are a growing organization, and so being cautious cost effective and efficient is really important. And again, both Kevin and myself here, we're pharmacists. There's no way that I would be able to speak to any of the dental equipment, for example, or of the optometry equipment, as we are wanting to expand out these components for more sustainable and impactful care to the rural communities that we serve. Um, Also, part of our mission, as we kind of noted before, is heavy student involvement. So we really wanted to have advisors who would be willing and open and welcoming to allow our student volunteers and leaders to reach out, to hear, a little bit more information about the field, to act as a mentor if it's within your capacity to do so. But in all of our students, as they're helping the rest of the leaders and the organization in getting ready for clinic, they're putting together, some of these materials, some of the trainings, and we want to seek that guidance from you as our experts in the field, whether it is correctly termed or taught out. Is the content still relevant? So this is a great opportunity to allow our students an avenue and exposure to all of the great disciplines out there in the healthcare industry. And I'm hoping that it will infuse some of their energy into you as a practitioner, as well as for you to help perhaps gravitate their thoughts in becoming a practitioner within your field as well. So a lot of these students are, again, kind of pre-health, and they may not quite know where to go next. And so you can help provide that kind of information, insight, and energy. We do have board meetings on a monthly basis. We welcome you as an advisory board member to join at any time. It is not required. There will be some opportunities perhaps that we're going to talk about expanding a specific component, or to talk about a project or something that will require your level of expertise. And so the rest of the board would love to hear from you and your thoughts and your feedback, or your resources that you would like to share with us. So that's going to be on an as needed, but the board itself do come together on a monthly basis to strategically plan for the future, as well as the daily needs of the organization in preparation for clinic. So that kind of goes into what would make me qualified, right, to kind of give back. And as I noted, we're just wanting anyone with a heart to want to give back, but perhaps don't know how or where to go to. Please join our organization as we're growing, and we want to continue this efforts for the next 10, 20, 100 years later, right? And we want to make it not only efficient, but impactful for the communities, every patient that we touch on in Vietnam, as well as here in the United States. So kind of looking for that kind of same love to wanting to give back to the community. We do kindly request to have at least a minimum of a few years of it, kind of in the field experience, just because I know, and I feel like I'm dating myself, but not too long ago, when I first graduated pharmacy school, I just needed to be comfortable in my own field of practice, to be a pharmacist first, know what I'm doing before I can really, gather all of that knowledge that I've had and actually give back to the community effectively. And so we kind of have that similar thought process, that once you are ready and now you are comfortable in your field of practice, that you can now come and join us in making a difference in our patients' lives. We do look for those who are open again to supporting development of students, just because it's so heavily infused into our organization, where we originated as a student-led organization. And so helping our future leaders of healthcare is an important factor. And I'm hoping that those who will join us will also have that, again, kind of that love or that passion to share to our students for the future generations. We are looking for, and it's listed out here, but not limited. So if you don't see either your area of expertise, or you're just wanting more information that perhaps it's in an area that you feel that you can contribute, please reach out to the board or to myself, to Kevin. Let us know. I'm sure we can have a discussion about it, and maybe it's a field that I totally miss completely while we're putting this together. So don't hesitate to become involved in our organization and reach out. Lastly, it's kind of the level of commitment. We do ask that once you are onboarded to become an advisor to our board, that there's going to be at least a 2-year minimum. And that's just really because it does take about a year to really get what we are, who we are as an organization, what we do, and how to look for the future for the next 3 to 5 to 10 years. And so that's why we kind of wanting that 2-year kind of minimum. First year is to kind of get introduced into the organization, and then that perhaps that second year is where you really can make those key decision making, like processes and an expansion of components along with us to our patients. On a month-to-month basis, it really does vary. There will be months like this month, for example, or like around the holidays, where it may be just a couple of email correspondence. And we do factor in, that's why it says 1 to 2 hours a month. That is to factor in any emails that we reach out and like, hey, do you have a moment? Would you be able to take a look at and review this document to see if the content, again, is relevant, accurate, and appropriate? Perhaps we're doing a research on, dental portable units that we would like to procure, and sending a quick email just to have you take a look at any quick feedback, and not necessarily any in-person meetings. As we're going, or as we're planning for our mission trip here in summer of 2023, there will be a lot of training and presentations that will be leading up to help really equip our student volunteers and healthcare professionals to be ready for our clinic. So we do ask, and it's a really fun time for you to come in and provide, again, that kind of either clinical knowledge or area of expertise within your discipline to share out to our students or to other healthcare professionals. Like I said, we're very interprofessional here. And so sharing out with the other professionals, how is the process like? What is your thought process? How do you approach patient care? And sharing that same vision with the other healthcare professionals, so that we can all collectively, right, make the most impact for the patients that we're serving. So it could vary, again, anywhere from maybe an hour or so with email correspondence to, if you would like to come and present and do a clinical presentation, participate in a mock clinic training that happens historically around like late spring to early summer in preparation. That could take a few additional hours, but it's one of the most favorite items or times that I would say our health professionals typically have, is that engagement with the student volunteers, and you really feed off of that energy just before our clinic or before our mission in Vietnam. So with that, I just wanted to wrap up and say thank you for everyone who's listening to this and have an interest in becoming one of our advisors to the board. Please feel free to reach out to any one of us on the board if you have additional questions or concerns. Myself, I'm Mylin. I'm happy to schedule a call or a virtual meeting and kind of go through a little bit deeper in your specific area of focus or expertise. But looking forward to seeing your emails come through. Kevin, anything else I'm missing?
No, like, I just want to echo what you said. I think if you are an expert in your field and you believe in the work that we do, and you would like to contribute, please do reach out. And you can visit vnhealthclinic.org, go to our Advices to the Board page. There's an interest form there. Love to have a conversation with you, and love to collaborate.
Awesome. Well, thank you for
Thank you,
listening.
everyone.